Wait for the doctor. The doggy doctor.
Professor Noel Fitzpatrick
All right, missus. Cuddle monster incoming.
is the Supervet.
We have issues.
I knew I should have got chihuahuas.
At his unique vet practice, he merges mechanics and biology.
Past the point of no return now. Don't be pulling apart my repair, missus.
To heal the nation's pets.
Sorry about coronavirus.
Oh, because you're responsible?
I'm responsible for almost everything else.
Even in the darkest days,
Worst thing ever.
Noel imagines the impossible.
Oh, my little baby girl's leg.
Let's go. Sometimes you have to bend the rules of mechanics to fit the biology.
And offers hope.
We've definitely made the right decision. Good boy. We've got my boy back.
For families and their friends.
Look at you! Bionic doggo!
Yes, mate, I love you too.
People travel the length and breadth of the country to receive specialist treatment for their loved ones at Fitzpatrick's.
Look at you!
The first patient on Noel's list today has come over 200 miles from South Yorkshire.
You've got to be a good boy. Behave.
Steph and her family have brought in 8-year-old Dalmatian Milo, who has a long-term condition affecting his spinal cord.
I wouldn't say he has any good days. He has bad days and better days. He can't play, he can't run around off the lead. He can't do all the things that a dog like him wants to do.
Milo lives in Rotherham and loves being the centre of attention.
Sit. Good boy.
My family basically say that I've spoilt him because obviously he was here before the kids.
What?
And he might have got slightly pampered, but I don't think he's spoilt as such.
Food. We can't feed the kids while Milo's in the room because he will just nick food. I mean, he's terrible. Go on then. He loves a cup of tea. I mean, if you've got it, he'll have it off you. I mean, he makes no bones about it. He will have it off you.
Get down. It's coming. When we'd go sit down and eat, he would be in here creating holy hell because he could smell it and he couldn't have it. So we started obviously doing him some to have while we were eating, and then it worked. It shut him up. And now we can't do a roast without giving him some.
2 years ago, Milo was diagnosed with a debilitating spinal condition and has been on medication to manage the pain.
Watching Milo go from this happy, bouncy dog to grumpy, geriatric, not being able to walk properly dog, it was heartbreaking for everyone.
Since his diagnosis, he's not been able to do the things that he wants to do. So, you know, going for walks and playing. It's really important for him to be able to be a normal dog.
Milo has already been seen by the neurology team at Fitzpatrick's. They've referred him to Noel to discuss surgery.
Oh man, Milo's in trouble. And we can see quite clearly where he has multiple sites of deformity of his vertebrae and disc such that the spinal cord is squished, and also the nerves that come out on either side of the spinal cord are also squished. That means the impulses are not getting through properly from his brain to his limbs. This is giving him pain. Poor Milo.
Hi.
Hello, 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 hello. Sorry about COVID precautions and all that stuff.
Yeah.
First of all, who's Stephanie?
It's me.
And you are?
Michelle.
And what are you relevant?
Steph's mum.
Right, okay.
Oh, everybody does that.
You look amazing, even with a mask on. And you are?
I'm Ian.
This is my dad.
Perfect, perfect. Ian, you look amazing, even with a mask on. When is the first time that you noticed there was any issue?
2 years ago. He's always been clumsy, but
Right.
we just thought that was him.
Lovely fellow, aren't you?
He's never been able to cock his leg. He's
Okay.
never had the coordination.
Right, right.
But I never put it down to anything other than him just being a bit dopey.
Yeah.
We woke up one morning and it was like having a geriatric dog. He was in lots of pain, we had lots of yelping, he couldn't walk.
Was he ataxic, wobbly on his back legs?
Yeah, he'd lose his back end, knuckling over a lot as well. And his front legs got choppier.
It's called a double engine gait. On the back end, they're wobbly, and on the front leg, they're...
Yes.
Like, okay. So you know his problem's in his neck.
Yes.
The brain sends the signals down the electrical cable, which is the spinal cord.
Yes.
And the spinal cord is being squished in the neck like an hourglass compression of both disc and bone. The condition is called cervical spondylomyelopathy, otherwise known as wobblers.
Noel is planning a distraction fusion surgery to try and relieve the pressure on Milo's spinal cord and nerves.
If I put a spacer device in here, which is like a Christmas tree, and goes up in between the vertebrae and pushes them apart, the objective of that is to give more room. And then we have screws that go up into the vertebrae on either side. Each of those saddle plates are linked together by rods and clamps. Okay?
Yeah.
Does that make you a bit better?
Because everybody we've seen so far has basically told me he's going to die.
Yeah.
And that's it, end of.
Milo's family will now have to decide how to proceed.
Oh, man.
He's a good lad. He's a good boy.
The practice takes referrals for both routine and complex problems. Often it's the end of a long road for families anxious to get their pets finally fixed.
Mate, what a time you've had this year, eh? Thought we'd gone over it, haven't we, mate?
We're not calling time yet, mate, are we?
What's the matter? Is that hurting? Is it hurting, baby? Okay, okay. It's all gonna be good. Good girl, yeah. Good girl.
Ollie, come here.
Debbie has brought in her 4-year-old Shih Tzu Ollie.
This way.
He's suffering from a painful leg deformity.
We just took Ollie out for a walk and we noticed that he wasn't managing to do long walks anymore, and he would stop and sort of have a rest in between, and he started actually holding his leg up. So that's when we took him to the vets to get Ollie checked out to see what was going on. He's had previous operation on his elbow, which hasn't worked, and he's now got quite lame. Not as bubbly as he used to be, but he's still got a very lovely character about him.
Ollie has been referred to Fitzpatrick's to see if Noel can offer any hope of saving his damaged elbow.
Come on, buddy. Good boy, Ollie. He's quite slow, isn't he?
Yeah, he doesn't get much faster.
Come on, Ollie. Good boy. Come on in and see us. The original surgery was done to try and address a poor fit of the elbow, was it?
Yes, he went back for post-op x-rays and they said it hadn't worked.
This notch didn't fit properly in the humerus. What they tried to do was cut the ulna here to try and let this notch get better fit into the back of the humerus.
Yeah.
Unfortunately, the cut is not made in a position that allowed this dog to heal.
I must admit, my vet at first said I was to consider euthanasia.
Well, in my opinion, this is not a euthanasia situation.
No, God, I hope not, no.
And in any case, we would always consider full limb amputation before we would
Yes.
consider euthanasia.
Yeah.
Pop him up on there, please. Thank you. You talk to his head, please,
Good boy.
Debbie. Thank you.
Noel has had the elbow joint recreated with a 3D printer using previous CT scans.
This has been cut here and it's slipped out the back like so. You see that?
yeah.
So there's no support.
Nothing there at all.
Nothing there. He's very patient, isn't he?
Yeah, he's very good.
Okay, great. Well done. Just let him be at ease. Whatever he wants to do is fine. So now you can see the major crisis we have. The whole elbow has dislocated, and that has resulted in this and that. So what are we going to do? I'm not going to be able to get a functional elbow out of that elbow by putting the pieces back together because of two reasons. One, the bone is too deformed, and two, the cartilage is too eroded. So this is my plan.
Yeah.
The only way that I can get that elbow straight and functional is to fuse it solid,
Right,
because I can't save the joint
okay.
and make it not painful.
Yeah.
I plan to take this highly deformed elbow and make it straight by fusing the elbow solid and by moving the bottom part of the radius so that the paw is twisted back in.
Yeah.
And these are the kind of implants we're going to custom make for this operation. Is that still your desire?
Yeah.
Okay, fine. I have more design work to do on this. This is not the final version. Right, mister? Look after yourself. You're such a good boy. My little Ewok friend. Well done. Good. All right, thanks, Debbie. Thanks for coming in.
Thank you very much.
God bless.
Before Noel can perform this complex surgery, he is arranged to seek approval from an ethics board.
When the condition is this severe, we must make sure that we do what's in the dog's best interest. And my opinion or the opinion of the family isn't enough. So we must refer to an ethics committee so they can decide whether amputation or surgery to try and save the leg is the best option.
It's quite a shock actually, and it's a lot more serious actually than what we thought. Just feel really sorry for him. I haven't realised that he's in more pain than what we thought he was. It's quite hard.
Oh, crikey. Now there's a Tuesday.
1, 2, 3.
Fitzpatrick's referrals perform over 400 spinal surgeries every year.
But you're glad you missed last Wednesday. Kind of stopped on the day and I was like, guys, we've just done like 21 surgeries.
Often with life-changing results.
And we did take 2 discs out. And we did learn to walk again.
Milo's family has decided to proceed with the surgery on his spine to treat his wobbler's syndrome.
We may or may not improve his wobbliness. It depends on how badly the spinal cord's damaged already, but hopefully we can hold him where he's at and stop him getting worse and resolve his pain. All right, gown, please. Scissors, please. Incision.
Noel will expose the spinal column and drill out the base of the affected discs. He'll fit spacers between the vertebrae to relieve the pressure on the nerves and spinal cord. The spacers will be locked in position using saddle plates and screws. Then rods will be fixed between them to provide a rigid structure.
Okay, we've now exposed the 3 sites that we're going to fuse. We're preparing each of the intervertebral discs to receive the implants, and we do that by taking off the bottom part of each disc. And then we stick a device in between each of the vertebrae, like so.
The spacers push the vertebrae apart, relieving pressure on the spinal cord and nerves.
All right, we're now going to put saddles on each space in turn. So this saddle is going to go between C7 and C6.
When all the parts are in place, they're connected by the rods.
We're now just tightening the clamps on each of the units so that all 4 vertebrae are going to be rock solid.
Noel uses some of Milo's bone marrow to pack around the spacers to fuse the vertebrae together.
So we've now completed the procedure, and over time the pressure that's on the spinal cord and the nerves hopefully will stay resolved, and hopefully this will get Milo out of pain, and if we're lucky his gait will improve as well. Yes please, thank you. All right, let's go to X-ray. Thank you everybody, well done.
Are we going there first?
Okay. Good girl.
Over the past few months, social distancing has meant that the car park has become the waiting room.
What car park are you in?
Excuse me, could you tell them Pippa's here, please?
Yep, perfect. You just remaining your car for the time being. Thank you.
Bye.
Can I get a Big Mac and some milkshakes, please?
Oh no, there's a doggy there. Later. Good boy.
I wonder what that is. I've never seen one like that.
Good boy.
Moon is a 10-month-old Chuskie pup. Despite being so young, he's already suffering from severe developmental elbow disease in both front legs. Laura and Max are determined to help him.
It almost feels unfair, you know. He's still a baby. He's a baby to us.
I don't know what I'd do without him. Yeah. He's had such a huge impact on our lives. Yeah. We've got to do this for him. We've got to make sure he gets everything he needs.
We just want him to be happy.
Moon lives in Hove with Laura and Max in their second-floor flat.
Kissy Mama?
Moon is a Chow Chow cross with a Husky. We wanted the Chow because it was the first dog Laura sort of fell in love with. He was just such a happy puppy, such a good temperament. Who's this?
It was really busy like having a baby. Well, we had a small bed for him and we would carry him out. We'll go and have a coffee while he's laying in his own bed. Everyone that saw him had to come and say hello and stroke him. He had a lot of attention when he was a puppy. About 3 or 4 months he was, and we just noticed that he's limping.
It never got better, it was only getting worse. And then it reached a point of he was really, really bad.
We just went to the vet, did an x-ray.
That's mine. Oh, that's mine.
And they said, it's bad news, it's elbow dysplasia, it's, genetic, and it's not fixable. He's just gonna get arthritis, and that's just gonna be it. We almost blamed ourselves. We just thought we made it worse, because we don't have a garden, we live upstairs and he has to go down the stairs.
Moon has been a friend to Max in hard times, especially when his mother died.
Moon was just always there, and he just got me through that time. It was such a bad time, and I almost feel sort of indebted to him to just get him through this, and I'll do anything for him to make sure he gets the life that he sort of deserves.
This is Moon's second visit to Fitzpatrick's.
Hi there.
Hey, Noel.
Good morning, good morning.
Noel has already performed a keyhole investigation and surgery to alleviate the immediate pain in his elbows. Today he's due for further surgery.
What we did 10 weeks ago is we stuck the scope in both elbows. That's on the better side, on the right side. I stuck this blade in and I cut a tendon here to reduce the rubbing between here and here. I took the tip off the cracked area here. So that's that fragmented tip has been taken off. If we look at the other side, it's much worse. We've got not just cracking, but extreme erosion between here and here. So that butt cheek is rubbing against that part of the saddle. So the butt cheek doesn't fit in the saddle and that's worn away. That is rubbing against that all the time. Raw bone against raw bone. So I'm just gonna do a little physical exam now.
Hello, baby boy. Hello, my darling.
Okay. So all I'm gonna do is this, this, and this.
Yeah.
It's gonna be very temporary, but it's baseline. I have to do baseline.
Yeah, no, we have to do it.
1, 2, 3, go.
No, baby, I know.
It's okay, sweetheart. It's okay.
I'm not actually doing anything because he doesn't want me to touch his elbow. You've no idea how much pain he's in. None whatsoever. Because the dog's lame on both sides. So this is the good leg. But clearly it's not good, is it? Our assessment of the situation is that these elbows are going to get bad very quickly in the next several months. Therefore, the proposal on the right-hand side is to do what's called a bioblique proximal ulnar osteotomy. Make a long oblique cut in the top of the ulna. And that results in a free segment which flips back and down, moving the notch relative to the butt cheeks. What we're aiming to do is to ameliorate the progression of erosion. You can't cure it. You're never going to make that notch perfectly fit the butt cheek.
Are we just sort of slowing it down?
Yes. You're not curing it. You're just slowing it down.
Okay.
So on the left elbow, you've got raw bone rubbing on raw bone. So this is a much more aggressive procedure. You put this step locking plate on first, then you cut straight through. You put this part onto that part of the bone, you put a few screws here, you make your cut, you tighten these screws and it pulls the bone that way. Remember, what we're trying to do is move the top half of the bone this way to shift more load onto this butt cheek, which is the good side of the joint. Do you want to give him a cuddle, guys?
Hey, baby.
You got this, baby. You got this.
Come here, baby. Hello,
I love you more than anything.
Okay. All right, guys. We're going to take him through.
I want to be sort of have a realistic expectations of what
It will hopefully be worth it when you see him run around the field in 16 weeks from now.
it will be, because we thought we didn't have any hope, to be honest. We thought we were going to lose him before we came to you. So thank you so much.
It's okay. I've seen it all before.
Oh, yes.
All right, big fella. Look after yourself.
We don't know what we're going to do in the next 7 days without him in the house. Honestly, we're just like dreading going back home to an empty house, to a quiet house with no one chewing on stuff.
Yeah.
Hello, little man. Just quickly listen to the old ticker.
4-year-old Shih Tzu Ollie with a painful elbow deformity has been given the green light for surgery to try and save his leg.
So we're going to try and fix Ollie now. The point is to get him out of pain and to allow him to use this limb with reasonable function. But the outcome at the moment is unknown because it's a complex operation and we're just going to have to do our best. All right, here we go. This is not a typical elbow fusion. It's a growth deformity correction as well. There's a lot going on here. I'll need another stapler on standby in a minute.
With the leg opened up, Noel can see more clearly the soft tissue areas which CT scans were unable to show.
Be careful, the ulnar nerves behind that. Unfortunately, the anatomy is quite disrupted here. The nerves and the blood vessels are disturbed in the way that they run because unfortunately there's been surgery here before and there's a lot of fibrous scar tissue, so the pathway that I would normally follow is not so clear.
The scar tissue has made Noel's job much harder.
There's only one rule, and that is get to the bone and stick to the bone. The bone is all I've got as a landmark and everything else is disrupted. So this is the head of the radius bone that we're exposing now, which was dislocated.
Noel cuts the radius bone so he can twist the paw back into alignment with the elbow.
So what's going to happen is I'm going to reconstruct the bottom part of the radius using this plate, and then this plate is going to go up the outside of the ulna right to the very top, and then this plate is going to link in to the humerus at the back here. Pull that out. This has got so much scar tissue around it. I'm trying not to disrupt that if I can. And now we're putting in permanent screws which physically lock into the plate to hold it in position.
Once the plates are secured on the radius and ulna, Noel drills out all the cartilage in the elbow joint. Then puts another plate down the back of the humerus.
Do you have any, the other Allen key, please, on the handle?
Now the plates can be locked together and bone graft placed to encourage fusion.
We've now got this linked plate on the back of the humerus and down the side of the ulna, through the back of the ulna into the radius here and onto the front of the radius. The top part fuses the elbow solid. And the bottom part we cut here to change the position of the paw from here back into a straight line. Now everything is in a straight line. All right, give me swabs, please. Okay, so this is a three-dimensional CT of the limb now. The elbow had been dislocated for such a long time that it had totally collapsed down and all the normal anatomy was destroyed, and there was a ton of scar tissue in there. But Ollie was in so much pain. This is, in my view, the only way to save his limb. So let's hope it works.
It's been just 2 days since Milo the Dalmatian had surgery on his spinal cord.
Come on, buddy. Yeah, we'll go for a little walk this way. Come on, mate. Considering that we took out 3 discs and fused 4 vertebrae, this is a big deal, you know, 48 hours post-operatively and he's walking like this. It makes you realize why you became a vet, why we advanced science. It makes you grateful that we're able to do this kind of surgery now. Hopefully in 6 weeks' time when we take his next CT scan, he'll be all healed. And then you can get on with life, mate, can't you? I love you, mate. Yes. Oh my goodness, what a difference a couple of days make.
Hello.
Do take a seat. There's alcohol there.
Thank
and
you.
Mind wearing your mask. That's perfect.
Proper alcohol.
No.
Yeah, not to drink, just to put on your hands.
Ollie the Shih Tzu has been having regular massage to improve the blood flow to his leg since his operation.
Hello, mate.
But this morning, Noel is concerned about his progress.
So we've got a problem with Ollie. It's been 3 nights now since we did the surgery. But unfortunately, his foot has got colder, meaning that there's a problem with the blood supply. The blood coming down the arteries into the foot is not returning at the correct rate in the veins going back up the foot. And so the blood is becoming somewhat stagnant and the foot is becoming cold because it's deprived of a proper blood flow.
The team have used modern-day techniques, laser therapy and releasing the incisions, to try to improve blood supply. Now Noel is trying an age-old remedy.
Leeches are quite remarkable creatures. They've evolved over the years to suck blood very effectively. They've got 3 jaws, each of which has 100 teeth on it, like a Mercedes symbol. They inject a substance called hirudin. It maintains blood flow in the area by decreasing clotting. Clots are not forming and the blood is flowing more freely down and back. Yes, mister, you can come. Here you go. So our friends are at work doing their biological job. Man still has not developed anything as effective as leeches for getting blood flowing. All right, so that's 10 leeches on the toes now. Sucking out the blood, hopefully, improves blood supply, but it may be that the blood supply does not come back, in which case we will be taking his leg off, unfortunately.
The team hasn't given up hope, but Ollie will need to stay a few days more.
Well, I think this is just wanting some attention just now. Hey, buddy.
Hey, buddy.
At home in Chessington, his family are missing him.
The house seems so quiet without him. It's just not,
Bear doesn't want to play, doesn't want to do anything.
Ollie joined the family 4 years ago, along with Bear, his brother, from the same litter.
Just always together. The naughty two, really. If you know where one is, you'll definitely know where the other one is. Don't think he understands what's going on. He's not really interested in playing. His walks he's not particularly bothered about. So it's had a huge impact all round, really, and we're just missing him terribly.
It's Ollie. Where is he?
We have had regular phone calls every day from Fitzpatrick's, which is really good. Just getting him back really is all we want, and a better quality of life.
All right, let's see what we have here.
Back at the practice, Ollie is having his 2nd day of leech treatment.
Here, well done. What I'm trying to do is to put one for each finger. I'm trying to put where the tissue is more dark. Not that easy. Good boy.
But the parasitic worms are finding it hard to get the blood supply back.
Hiya.
And Noel is updated on the disappointing news.
So in the 2 toes in the middle, none of them would attach. I don't think there is much alive tissue. I'm not sure how much progress we are having. You have been such a good boy. Yes.
Most animals stay at Fitzpatrick's for 1 or 2 nights. So when families drop them off, their comfort is key.
You can always tell when the dog is pampered when they arrive here because they generally smell pretty good.
She smells like talcum powder and love.
Their locks are always looking quite luscious. Yeah, you can tell.
We can give them a little brush and give them their own treats.
They will be hand-fed or they'll have someone sit in the kennel with them while they're eating.
Good boy. Sausages in particular are a popular choice.
Kisses, kisses.
We really do want to try and make everything normal and at home and familiar for them because it does help their recovery.
So special, like the pooty go.
Dogs probably come before children sometimes in a family.
You're so beautiful, aren't you?
They are people's babies.
After a speedy recovery from his spinal surgery, Milo the Dalmatian can go home, which is good news for the family's kitchen.
2-year-old, when he's finished with his lunch or whatever and there's bits that he don't want, he always goes, throws it over the gate into the kitchen for the dog. So the fact that Milo's not there means that my kitchen has been covered in all sorts. Thank you.
There we go. Right, Milo's doing well.
Yep.
It's early days, so it's going to be a while before everything is settled down and healed.
Yeah.
At the moment, you're just doing 15-minute lead walks 4 times a day on the harness. No running, no jumping, no slipping, no siding. Okay? It's very important. We don't want any Bambi.
No.
No bashing down.
No.
Supporting harness, because Milo's raring to go. So if you let Milo out now,
He's just going to go.
he'd be off. I think it's best if we just reintroduce you in the yard, because he'll get very excited. Now, there we go. Hello, Mama. Hello, Mama.
Absolutely brilliant. Just want to get him home. I do.
He looks happy enough, doesn't he?
I am so chuffed. You're a good lad.
Missed you, mate. I have.
Are you happy? Yes, you are. Yes. Once we get home, a cup of tea is the first thing I think that he'll be in on
good
cards
bro.
for him. I think
Good
he'll be
bro.
wanting that.
Someone coming to see you soon? Are they?
Hello, gorgeous.
Look at that tail.
Oh, how are you? Hi. Hello.
He's got that look in his eyes that says, I want to go home, watch Netflix and eat junk food. Yeah.
Moon, the fluffy Chuskie pup, is being prepared for surgery on both his front legs.
I'm going to do my best to try and get him out of pain by cutting the humerus on one side to shift the load and cutting the ulna on the other side to shift the load. There are those that would say that we shouldn't operate on both legs at the same time, but there's also an argument that because we're keeping him in here for a while, that he gets through the procedure more quickly. The decision rests with the family. I've given them both options, and they've decided that we operate on both legs at the same time. All right, left thoracic limb is the plate. Let me see the plate.
As Moon's left elbow is affected by more severe erosion, Noel will use a plate he and his engineers developed to cut the humerus bone and unload the painful area.
Left this side, SHO. We're just cutting down on the humerus of the left forearm now.
With the humerus exposed, Noel's first job is to line up the step plate with the bone using temporary screws.
We're trying to center the plate on the bone. Should stay straight up and down. So at the moment this isn't exactly correct. I'm going to need to twist the plate somewhat. This is the critical step of the process. This has to be right or everything goes wrong.
He now fixes the top part of the plate with locking screws.
There you go. Okay, so we've got permanent screws in the top segment now. We've now anchored the top of the plate to the bone. We're going to cut the bone in the middle and pull the bottom of the plate over.
He anchors the bottom half of the humerus in its new position with 6 more locking screws.
So the hope is that this will alleviate Moon's pain by unloading the inner compartment of the elbow. That reduces the rubbing and hopefully decreases the inflammation. Alrighty, that's that leg done. We'll now do the other leg. Okay, so we're going to make a long oblique cut now in the ulna.
Moon's second leg requires simpler surgery.
This top bit is going to kick backwards, and therefore it'll lower down the ulna inside the elbow. We're not going to cure the osteoarthritis, that's not possible, but we can reduce the rubbing inside both elbows. Hopefully, we'll make the next few years a lot happier for him than they would have been without these procedures. Well done, Moon. Let's go to X-ray, guys. Thank you.
After intensive treatment, including massage, incisions, and leeches, the blood flow has still not returned to Ollie's foot. Noel only has one option left.
Hello. Hi, Debbie.
Hi.
I know you're expecting the call.
Yep.
It's not good.
Okay.
So I've tried my best. The team have tried their best, but the blood supply is not establishing itself to the foot.
Yeah.
I think we've come to the point now we need to take the limb off.
Right, okay. You did your same, obviously the best to save the leg, didn't you?
Yes. Well, I'm heartbroken, and
I can tell how upset you are as well.
Yeah.
It's been horrible, and his brother Bear, he's absolutely lost without him, you know, he's just not the same dog at all. It's, yeah, it's horrible.
well, God bless, and I'll ring you in about an hour.
Thank you. Bye, bye.
We put endless weeks into planning complex procedures, making custom implants, doing the actual operation, taking care of the patient after the operation, and still we failed in Ollie's case. I am beating myself up. I do feel very personally responsible, and I wish that I could save Ollie's leg. The reality is that all surgeons fail, and any surgeon who thinks they don't is deluding themselves or deluding other people.
Put it down, please. Thank you.
The operation takes just an hour, but it should mean Ollie is pain-free for the rest of his life.
Get rid of all dead space, because dead space collects fluid. We did our best, didn't we? We did our best, buddy. Come on, mate. Come on, Moon. Come on, buddy. Come on, buddy. Come on, mate. Well done, Moon.
It's been 6 days since Moon had double surgery on the elbows of his 2 front legs.
Moon is walking testament to the fact that we can do surgery on both sides if we're careful and if we very attentively monitor the post-operative period. Patients can do really well. And I'm happy that we don't need to put him through surgery in 4 to 6 weeks' time, having recovered from one and then going into the other. And I'm sure he'll be happy with that as well. In 6 days, he's through it, and hopefully the future looks bright for him now. We're going home, mate. It's all good. It's all good, mate.
Max and Laura have been preparing their second-floor flat for Moon's rehab.
We were busy. Max built him like a house for him to recover, which is really cute. Yeah, and we're ready for him. We were really nervous because we don't know how we're going to do with the aftercare.
Right, Moon. Sorry about the delay. So the good news, Moon is doing well. Everything's proven to be just as I would hope it would be. So what I would say is the least walking possible. If you can do none, do none.
Okay.
So just pee and poo, that's it.
How long?
4 weeks to 6 weeks, because we need to get this to start to heal.
So going down the stairs?
Ideally, you lift him.
I'm going to carry him. Yeah, there's no doubt with that.
Yeah, carry him. All right, let's go outside.
Thank you, Noel. Thank you so much.
Now, there we go. Pop him down.
Oh.
Good.
Hello, 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 baby. Hello, hello, hello. Hello, puppy.
Oh, you're looking so good.
He's so handsome.
You're so
You're
good.
so handsome. Hello, baby.
His tendency will be to do too much. He can't run.
Well, thank you so much.
No, pleasure. God bless. Cheers. God bless.
Yeah. You expect so much worse. You expect him almost not to be walking, so it's really reassuring to sort of see him up and so happy and so
strong.
Yeah, so strong. Makes me a bit nervous for what's to come, to try and keep him contained and calm, but we'll manage.
A few weeks later, Moon is getting VIP round-the-clock care, including regular lifts down 2 flights of stairs to the front doorstep.
Come down, Emily. Hello, puppy.
Thank you. Well, we haven't got a garden, And Moon just loves to be outside. He's a people watcher. And he can't obviously go to the park anymore, so we just sit here with him and he's quite happily just chilling here.
Yeah.
Also, he's just can get a bit more stimulation, gives him a break from the cage.
Good boy. I honestly feel like I'm a prisoner. I'm literally Moon's slave. Because I've not left the house in 3 weeks.
But we will get through it, and the end goal is a happy, healthy pup, you know?
Yeah.
Hi, sweetheart. Do you want some dinner? Do you want some dinner? He's just quite obsessed with cuddles at the moment. He says, I don't particularly want your food, but I'll have your love and attention. Hey?
Since surgery to remove one of his front legs, Ollie has been enjoying the one-to-one care offered by the staff.
Good boy.
It's been a week since Ollie had surgery now. He's been on pretty heavy-duty painkillers, but he's in much better shape now. I'm just glad he's happy and he lives to fight another day. All right, big guy, off we go. Ready to go home, mate? Mama's here. My lovely friends. Now, come on, mate.
Debbie and Chloe are desperate to be reunited with Ollie after 2 weeks apart.
Oh, he looks good.
See how happy he is? That's good, isn't it? That's good.
Oh, he looks so much better.
He does. Yeah, he does. You just attach your normal lead. He can walk along, just sniff the daisies. It's our pleasure, it's our pleasure. Look after yourself.
Amazing to have Ollie back. He just looks so much better than we thought he was going to be as
So
well, doesn't
happy,
he?
yeah.
Yeah. He's just so much happier since before he came, so it just proves how much pain he was in before. I think we had the shock of him losing the leg once we got the phone call, but now, yeah, we've had time to accept it, and seeing him today is, wow, it's just brilliant. Just so good to have him, isn't it?
Yeah.
Yeah.
We've got a bear at home, our other dog, so be excited to see him.
Don't know if he's got 3 or 2 legs, does it? No, it's brilliant, really good.
Moon, the Chuskie puppy, is back for a final checkup after a long and intense recovery at home.
It's been so hard. It's been exhausting. We haven't slept. We just haven't taken our attention off him for a second, so.
We are at breaking point.
Yeah, we're really worn down, but it's worth it. It's absolutely worth it. But yeah, it's been a lot harder than we thought.
I mean, I feel like a wolf. I've been like in the cave with the dogs and the wolves. Oh no, it's the Johnny one.
The good news is that everything is going great.
Aww.
So I'm very happy with how things are progressing. So you've done a great job at restraining the motion. I'm going to get him. I'm going to get him.
He's going to be excited to see us.
Come on, mate. Come on, buddy. Now, who have we got here? Who have we got here?
Hello, monster. Hello,
monster.
Is he a bit drunk?
Yeah, he's a little bit groggy, a little bit groggy. So, as much walking as you like on the lead. No need for the cage in the house, but no stairs.
For the 6 weeks, I've been holding him like this, like supporting him.
Yes.
I need to do that still.
No, you don't. Just a 2-foot lead. It's fine. You've done a fabulous job. Well done.
Quite literally, we are over the moon.
Yeah.
I'm so ecstatic.
So we've got 6 more weeks to go, and hopefully then he can be free.
Yeah,
he can be a happy puppy.
Yeah.
In Rotherham, tea-loving Milo is back, grabbing his family's attention.
Beforehand, when he used to walk, with his back end, he was really wide and low, almost like a bit like a frog. And his front legs were really kind of choppy and stiff. Whereas now, I mean, he's prancing like a pony. He's a good boy. He's so much better.
It's going from strength to strength. Every day is a better day. He's took about 10 years off him, hasn't it? I mean, it's mad.
Now, he's running around like a spring chicken again. You can see it in his eyes as well, can't you?
Yeah.
He's just brighter.
He's got that mischievous look. Everything's gone, you know, south this year. The one good thing to come out of this year is Milo. We can't thank Noel enough. Throughout all of this, no matter what he's been on, what's been done to him, Not once has his appetite gone down.
Yeah, he's a good boy. Ollie!
In Chessington, Ollie has been reunited with his brother, Bear.
It was really nice to see them reconnect. You could definitely see that Bear had missed him, and yeah, no, I think they were both just sort of like a relief that they were back home, back to normal again.
Come here, mate. Good dog.
Ollie's been getting on so well with his 3 legs each week. We're noticing an improvement in his energy, his strength, and it's just lovely to see him running about, playing.
Good boy. Yes, you are.
And to see how he is now on 3 legs, it's 100% better than what he was with the 4 and the bad leg.
On the south coast, it's a big day for Laura, Moon and Max. After a gruelling 12 weeks of carrying Moon up and down 2 flights of stairs, Max is finally free, and Moon is off the lead.
He's been brilliant because he's just been full of energy. I'm a little bit of a monster, but it's so good to see.
Good boy. Good boy.
I feel like we've got a real dog now. I can actually take him out for a walk. He's so fast. Honestly, the difference is unbelievable.
Just for him to be able to go off lead and just play with his doggy friends without having to worry about being in pain, that's enough for us.
When you get Lila.
A dream. It's an absolute dream. We've got our boy back.